Please examine the patient's lower limb.
Okay, thank you, sir. Encik, saya Dr. Ikhwan. Saya nak periksa kaki ya. Okay. For exposure for the lower limbs, I would like to expose the patient from the umbilicus until the tip of the toe. For the patient's modesty, I ask the patient to wear his underwear so that I can expose from the pubic symphysis to the tip of the toe. Okay. As I can see from supine position, there is a tortuosity of the vein on the medial aspect of the lower limb. So I think this patient has a varicose vein on the long saphenous system. So I would like to stand the patient for proper examination. Periksa sikit cik. Upon standing position, the varicosities looks more prominent. It extends from the anterior aspect of the medial malleolus, runs on the medial aspect of the leg, medially at the knee level, inserts on the medial aspect of the thigh, going slightly anterior at the upper thigh. There is presence of lipodermatosclerosis with a swelling of the lower limb and also area of redness to indicate superficial thrombophlebitis. Upon inspection of the short saphenous vein, there is no varicosity seen. Posterior aspect, there is no varicose vein seen. Next, I would like to palpate along the varicose vein. Kalau sakit, kita tahu ya. I can feel a blowout below the knee level. Another blowout above the knee. Sakit kan? Sakit. There is some tenderness around the redness to indicate superficial thrombophlebitis. This patient most likely have a long saphenous vein varicosities. I would like to lie the patient supine for a tunnel or single tourniquet test. Cik, saya kat kaki sekejap ya. Okay. First, I would like to empty the vein. Okay. Once the vein empty, I ask my assistant to hold the limbs where I have to locate my saphenofemoral junction. Pubic tubercle, 2.5, 2.5. Okay, here is the saphenofemoral junction. So I'll put my first tourniquet below the saphenofemoral junction. And I ask the patient to stand again. As the patient stands, I don't see any feeling of the vein. So I would like to untie this tourniquet. When I untie this tourniquet, I can see the feeling comes from above going down. So this indicates SFJ incompetency. I would like to lie the patient again for further tests. In this patient, since there is no feeling before the SFJ is tied, so I don't think this patient has perforated incompetence. However, if I have to do examination for perforated incompetency, I would like to put few tourniquet. One is at the SFJ, one is at the above knee, one is below knee, the other one is above ankle. Okay. I would like to perform Pertis test for this patient to indicate deep vein thrombosis. Again, empty the vein. Then I put a tourniquet, same as I'm doing the single tourniquet test. Next, I would like to ask this patient to walk tiptoe for 3 minutes. If there is pain within this 3 minutes period, it indicates the deep vein thrombosis, and the patient is contraindicated to go for surgery of the superficial venous system. To complete this examination, I would like to perform abdominal examination to look for any evidence of mass that causing a compression to the venous system. I would like to take further history to know about the risk factor before embark to any investigation. The first investigation that I would like to do is a Doppler ultrasound of the lower limb to look for the competence of the deep vein. Okay. At the end, if I need to offer surgery for this patient, there are only few indications. Number one is for cosmesis. Number two is because of complication. For example, recurrent varicose ulcer or lipodermatosclerosis. or a bleeding from the superficial vein. Okay, or symptomatic means the patient has heaviness upon walking because of the varicose disc. Okay, thank you.